Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
The clinical features of malignant Phyllodes tumor. This, of Phyllodes tumor, right? This Phyllodes tumor looks like smooth, round, and painless mass. Painless mass, and if you palpate it, you will see that there are multiple nodules are present. So it is a multinodular lesion is seen, and it is most commonly seen in the fourth decade of life. It is most commonly present in their 40s or fourth decade of life. It is actually a large tumor, and also it is massive, large or massive tumor, and it is easily mobile or always mobile over the chest wall. It has a bosselated surface, that is shiny surface is present. Why is this bosselated surface? Mainly due to the pressure necrosis of the overlying skin. You will see that even the skin, because it is a large tumor, even the skin gets compressed. See, here this is the breast tissue. Because this is a very large tumor, even the skin will get compressed, and because of the compression of the skin, there is pressure necrosis occurs, and this pressure necrosis will give this bosselated appearance. Diagnosis is by clinical examination. Also, we can diagnose the patient, or diagnosis. For diagnosis, we do mammography. In the mammography, we will see that there should be, we can find out the calcifications are found out, and also necrosis can be seen. But the main problem in mammography is it cannot differentiate between the benign and malignant lesions. So it cannot differentiate between the benign or borderline, or it can also cannot differentiate between the malignant Phyllodes tumors. So for knowing the malignancy, we should do a biopsy. But even if you do an ultrasonography, it will, you can see it has a discrete structure with cystic spaces. It is seen as a discrete structure with cystic spaces, but you cannot differentiate between benign, borderline, and malignant Phyllodes tumor. So for that, we should do a biopsy. Biopsy is actually diagnostic in these cases. Then, treatment of Phyllodes tumor. In treatments of Phyllodes tumor, it depends upon the type of Phyllodes tumor, the size of the Phyllodes tumor actually. If it is a small Phyllodes tumor, we can do local excision. If it is a large Phyllodes tumor, then we have to do a mastectomy. But if you see if you think that the Phyllodes tumor has suspicious elements of malignancy, it has suspicious malignancy. If you suspect that the Phyllodes tumor is malignant, then you should do re-excision of the biopsy site is done. This re-excision of biopsy site is mainly done to ensure complete excision of the tumor. In order to ensure complete excision of the tumor, you should do re-excision of the biopsy site, and also you should excise it with a 1 centimeter margin. And here in Phyllodes tumor, axillary lymph node dissection is rare, because axillary lymph node involvement is rare in the Phyllodes tumor. Because the axillary lymph node involvement is rare, so the axillary lymph node dissection is not done because it is rare. Only it is recommended if you diagnose it. Then, in Phyllodes tumor, metastasis can also occur in the Phyllodes tumor. So, in the Phyllodes tumor, especially metastasis of malignant Phyllodes tumor can occur, and this metastasis is mainly by the hematogenous spread. And through the hematogenous spread, what are the most common sites of metastasis? Sites of metastasis, the Phyllodes tumor can metastasize to lung, bone, it can metastasize to abdominal viscera, and also it can metastasize to mediastinum also.
thank you and thank you for watching.